Hi guys, I'm talking about laser therapy for my modality for advanced clinical practice. Um, so let's get right into it. So what is laser therapy? So laser actually stands for light amplification by stimulated emission of radiation. And these are usually used to admit physiological events into the tissues. So it's not generally used for warming of the tissue, but to create some physiological events in the tissues to promote different things, mainly healing. So lasers will vary from UV to visible and infrared light, which is going to be determined by their frequency. Um, and we'll get into some different types of lasers in the next slide. This is approved by the FDA for a number of conditions, mostly for carpal tunnel, but there are some others that we'll discuss as well. So how does it work? So the wavelength and frequency of lasers determines the effects. So normally lasers will range from a wavelength of 650 nanometers to 1200 nanometers, and this does not cause, again, like I said, the thermal changes in the tissue, but rather some photochemical events that will directly relate to some of the cells to help promote healing. So the depth of penetration of the actual modality is determined by the individual. So their melanin and their blood hemoglobin, because both of these can absorb photons, and that kind of determines how much treatment is actually being given to the cells. So if the melanin and the hemoglobin obviously absorb a lot of the light that is coming from the laser, that not a lot goes into the cells. So some different types of lasers include argon, which is a blue laser, helium neon, which is a red laser, gallium arsenide, and gallium aluminum arsenide, which are both infrared lasers. So the different lasers are used for different treatments depending and how much of the wavelength you need. So argon is going to be more of that 488 nanometers. Gallium arsenide is 904. Gallium aluminum is 830. And helium neon is going to be 632.8. So again, the wavelength is going to determine how deep the penetration of the laser is. So what is it used for? So a lot of the studies that I was looking at for my summary mainly talk about wound healing. So this is probably one of the better treatments to use with wound healing, because it helps to penetrate, create ATP, help with phagocytosis, and just kind of breaking down some of those cells and helping to build collagen as well. It helps with muscle strains, any sprains, carpal tunnel you see there, that was the main one that was approved by the FDA. And then some other interesting ones that I found was TBI. They actually have a skull cap laser that you put on, and that can help in the healing process of traumatic brain injuries. And then also they studied individuals who had a stroke. They again did that kind of skull therapy, which I thought was really cool. Some other things that I found, they did acupuncture laser. So they would just kind of find, obviously, those knots or specific areas that needed treatment, and they would put a laser kind of all around and somehow create that acupuncture with the laser, which I thought was really cool. So I always thought it was simply just the head of the laser, but they actually have a bunch of different add-ons that you can use. So they have obviously the skull cap, they have specific diodes that you can put for like trigger therapy and that type of stuff, which I thought was really cool. So the mechanism, so how does it work? This picture on the left came directly from Therapeutic Modalities book written by Chad Starkey. Shout out Christine. So that just kind of shows you what happens when laser energy is applied to the skin. So then it's absorbed by photoreceptors, and then it'll stimulate mitochondria. So you can see on the right that's showing you how that mitochondria is going to accept that photon and what it can actually do. So it can have a facilitatory response, an inhibitory response, and an indirect effect. So the facilitatory response is increasing that ATP synthesis, which can help ultimately with tissue repair. So you can see kind of the steps that it takes to get there. It has the inhibitory response, so reducing intracellular pH and decreased COX production, helping to reduce inflammation. And then it can have the indirect effect of increasing blood flow, enhanced lymph circulation, and deposition of granulation tissue, which is reduced inflammation. So you can see why, based on this chart, why it's really important for tissue healing, because we obviously need that increased blood flow. We need increased cell proliferation and all that stuff to help kind of heal any wounds that we have. So personally, I think this would be better used for that because you could probably see the effects more so than anything deeper. So thinking specifically of like football players who get kind of the raspberry or that turf burn, you can actually see the effects of the laser probably right away, versus if it was a deeper tissue like a muscle strain, you're not going to be able to see or visualize those effects as easily. But I thought this was a cool chart to include, also the picture, very colorful and kind of showing you exactly what happens. So application process. So you have to determine the dosage, duration, and frequency of the treatment. This is all device specific, so they all come with their own booklet that kind of tells you for each injury or application that you're doing, for how long that treatment is, the frequency, so how deep that you need to go, probably what lasers you need to use. And I know it does show you specific areas that you should be applying. I use this in undergrad, and when we did carpal tunnel, I know there was like 5 main points on the wrist that you had to hit when you are treating the individual. It's a pretty quick treatment, so it's not like it's 30 minutes long. I think if anything, you stay on a spot for 3 to 5 seconds and then you move, and you just kind of continue that treatment probably for 5 minutes, obviously depending on what you're actually treating. The laser applicator is to remain in contact with the patient, so it goes directly on the skin and the area being treated. Obviously, if you're moving it, you don't want to kind of pick it up super high. You want to keep it as close to the skin as you're moving it. In order to promote safety and have those precautions, they advise you to use glasses, so safety goggles for both the patient and the clinician. I have also seen people cover it with a towel, that way the laser isn't kind of shooting out in other directions. But it's definitely important to use safety precautions and refer to the user's manual for exact application procedures. Again, treatments are based on dose-oriented treatments, so per unit of area. So depending on how big the area is going to determine how long the treatment is, where it's being applied, and all that. The treatment duration depends on the type of laser being used. So again, whether we're using those argon, gallium, so blue, infrared, or red, that will determine how long that treatment is going to be. Also the pathology being treated, so whether it's for wound healing, for muscle strain, ankle sprain, those types of things, that's going to affect the treatment duration. Also the inflammatory state of whether it's a chronic injury versus an acute injury, and the power of the output. So definitely some important things to look at for application. They do advise just always referring to the device specific manual. So a lot of times treatment, you might think one treatment is the same for a different modality, or I'm trying to think of the word. But obviously each device is going to be different as far as length, penetration, all that stuff. So always refer to the manual. And then lastly, some indications and contraindications that we find. Again, this was taken from Starkey's book as well. So indications that we want to use it for: wound healing. I've also seen it for non-union fracture healing, musculoskeletal pain, myofascial pain, fibromyalgia, trigger points. Again, so I told you that they had that specific acupuncture to help with trigger points. Inflammatory conditions, osteoarthritis, rheumatoid arthritis, and carpal tunnel syndrome. So those are just a few of the indications. Obviously, they talked about some other pathologies that you can treat, so TBI and stroke. I do know those studies are still kind of out there. They're still working. So I don't know, obviously, the effectiveness of those or the efficacy, but I'm sure that will be studied further as well. So some other contraindications: applications to the eyes. So obviously we don't want to be putting a laser in our eye. Application to the thyroid gland, high intensity application over areas that can hemorrhage, over areas of active deep vein thrombosis or thrombophlebitis, over cancerous areas. Do not apply to the low back or abdomen during pregnancy, and any medications that can cause sensitivity to light. We obviously don't want to be using lasers. But ultimately, I think that laser therapy is a really cool modality. Again, I think I might use it more specifically for the wound healing, because everything that I have read so far in the literature, that was the main point. So they'll see a lot of, obviously, the effectiveness of that with wound healing and the direct of like turf burn. I do think, obviously, we can study more. I think the application using like skull caps for TBI is probably still out there being studied. But I think it's definitely a cool modality that I think athletic trainers can use. I don't know if I could specifically say that they should use. If you have it, obviously, at your fingertips to use. So at Kent, we're obviously getting one. I don't think it's something that you absolutely need to have in your facility, but if you do have it, I think it will be effective in helping to treat some of those things. But I definitely think it's a really cool modality to have, and definitely needs a little bit more study and background before we can really determine if it's a very effective treatment. But that's all I have. Thanks, guys.